Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube. Coming up, being vegan and being pregnant. We get asked about that a lot here on the show, and you may be even asking yourself, can a baby get all of the nutrients it needs without meat and without dairy in the diet? Well, today we are going to be covering everything you need to know about being vegan and being pregnant, because we have with us plant-based pregnancy expert Cheryl Furer. She's here with us today. Cheryl, thank you so very much for taking the time. We'll be catching up with you in just a little bit. She's going to walk us all the way through getting ready for pregnancy and how to eat after the baby is born, an all-encompassing conversation. And then we're going to turn our attention to childhood nutrition. How should babies be eating as they grow older? You know, childhood obesity rates are on the rise, and we're learning now that heart disease can begin in children in elementary school or even younger. Dr. Vanita Rahman is here with us to give us the science and to clean up those diets. Dr. Rahman, very important conversation. Looking forward to speaking with you. And we're going to be opening up the doctor's mailbag. So if there's something on your mind that you would like to ask the doctor, go ahead and post that in the comments section or the chat box. You can also tweet it to us using the hashtag ExamRoomLive. And then we're going to round things out today. A big show. Checking in on health headlines at the Exam Room News Desk. We've got news on how much headway plant-based meats are making in the major meat industry. We have a major first to tell you about, plus a tennis icon shaking things up in the vegan game. Tell you all about that in just a little bit. But we begin with vegan pregnancy and being vegan and being pregnant. How do you do it safely? Is that even possible? You may be hearing concern from friends and family members after you say, hey, I'm trying to have a baby and I'm eating a plant-based diet. Well, they may be wondering, can the baby get all the nutrients that it needs? Is that the right route to take? And what do you do to get ready to become pregnant when you're eating a plant-based diet? Well, Cheryl Furer has been studying these topics for more than 20 years. She is a midwife, an integrative health coach, and an educator. She specializes in teaching mothers-to-be how to have a healthy pregnancy and the benefits that come with a plant-based diet. And she's here to share that tips with us now. Cheryl, thank you so very much for joining us.
Thank you for having me, Chuck.
Let's start right off the top. I mean, we have heard from viewers who say, look, I'm vegan. My husband and I were trying to have a baby, but I'm also hearing from friends and family members who say, this really isn't a healthy idea. If nothing else, the child definitely needs milk. So what can you tell us about being vegan, being pregnant? How healthy is it?
Being vegan in the fertility time is actually you have a higher advantage than people that are relying on a lot of meats and dairy for their diets, because folate acid is one of the nutrients that is required to build a healthy baby right from the start. And vegetarians and vegans actually get a lot more folate acid in their diets than those that eat a primarily meat-based diet. So folate is very high in asparagus, leafy greens, mushrooms, whole grains, lentils, and these are often prevalent in a plant-based and vegan diet. And so being able to eat a variety of foods, making sure that you are getting lots of different nutrients in your diet is what is important there. A lot of people thinking about milk and dairy-based products are actually thinking about calcium, but often people don't understand that a lot of plants, so leafy green vegetables and almonds, are super high in calcium. And so being able to substitute those milks, almond milk or leafy green vegetables into your diet, is how you are building healthy bones and creating your reserves for your pregnancy to be.
All right, so let's kind of sum all that up in a nice box here. So is it your estimation that people who are eating a plant-based diet may find it a little bit easier to conceive a child? Is it fair to say that?
Well, conceiving a child is kind of a whole nother game, because there's a lot of other factors involved. But yes, the reserves for nutrients are a lot better for people who are already eating a plant-based and vegan diet, because they are already eating a lot of those foods that they're going to need to grow a healthy baby.
Yeah, and let's talk about once a woman is pregnant, what should she be adding to her diet or taking out of her diet to make sure that during those 3 trimesters, those 9 months, that the baby grows as healthy as possible?
Yeah, so eating a variety of foods is always my top choice. And also making sure that you're getting enough calories. So let's start with eating a variety of foods. When, as people, we often rely on the same 5 meals every week. That's a very common study that's been shown. But when you're pregnant, you want to make sure that you're getting your nutrients from whole grains, from lots of different beans and lentils. Soy products are really good for pregnant people. Also, like I said, the whole variety of rainbow foods, you're getting all those great antioxidants and you're getting all those nutrients from the different leafy green vegetables, your colorful fruits and vegetables, and eating a variety of foods. So switching up your meals, a couple meals every week that are different, that are new, trying to get the variety in your diet is really valuable and important. And in that way, you'll be able to get all of your nutrients from a plant-based diet. And that includes some particular vitamins such as like B12. Sometimes people think that they're not going to get enough B12 from their plant-based diet. But sea vegetables such as nori and dulse and kelp can be very high in plant-based diets. Also, a lot of plant-based foods are fortified with B12. And so as long as you're eating that variety of foods and it's truly a plant-based diet, then you're going to be getting the nutrients that you need for your healthy pregnancy.
Do you recommend some of your clients, when you work with them in the midwife capacity, do you recommend they use an app on their phone or on their computer that helps them track their caloric intake and the micro and macronutrients so they can really stay hyper focused and make sure that they're getting everything that they need?
It depends on the person. So for some clients, that is really valuable. They really appreciate being able to see that they're getting this wide variety of food, and having an app that makes that super easy can be a valuable tool for your pregnancy. I also know and recognize that in the first trimester, a lot of times our pregnancies are all about coping because our hormones are changing, and we might not feel like we're getting enough food in our diet, especially if someone's having morning sickness or nausea. And so in that first trimester, I offer a lot of grace to my clients in that if you've been building your reserves before pregnancy, then you're going to have reserves in those first few weeks during your first trimester. And so if you're having nausea and all you can eat is toast and peanut butter or something like that, maybe a banana here and there, that's going to be okay because you've built those reserves before pregnancy. And then in the second trimester, oftentimes those symptoms go away and you can really start to eat a full variety of foods again. And so I really kind of honor that process for my clients where they don't, like I said, if they find that app really helpful, then give yourself some grace in that first trimester, but that second trimester, like dive in. Yes, go for it. Eat that variety of foods, eat the rainbow. You're going to be well off into your third trimester from there.
And on this show, we talk so frequently about a low-fat vegan diet. You were just talking about grace periods and giving yourself a little bit of a break during that first trimester. But do you also say, well, maybe it's okay to lift the restrictions on some of that fat intake if it is, in fact, healthier fats?
Definitely. You want to eat healthy fats during pregnancy because your baby is growing, all of their nervous system and their brains are all built on fats. So those healthy fats, avocados, nuts, nut butters, you definitely want to include those into the diet. The percentages of fat can be a little different for everyone. Again, it sort of depends on where you started at and where you're at now. But usually between 5 to 10% of your diet should be fats, a little under 10%. But if you're getting them in those good, healthy ways with those nut nut butters, and from whole foods. So like walnuts are a great source of fats. Flax seeds. I know that flax seeds are really popular here on the exam room. And I also agree that they're super popular during pregnancy because you're getting all of those good fats, those omega-3s, those omega-6s that we have to get from our diet. Also that good fiber. Flax is one of my top choices for good fats and fiber during pregnancy.
And how do your fat and calorie requirements change throughout the pregnancy? Do they differ from trimester to trimester?
Not so much. Again, you really want to eat that wide variety of foods. And so you don't want to increase your fat during pregnancy. And as long as you're getting some of those omega-3s and omega-6s, your baby's going to be developing with all of those nutrients throughout your whole pregnancy.
Let's talk about after the baby is born, because a lot of mothers, they want to breastfeed. We hear that that's the optimum route to take for raising a healthy baby. So how should the mother's diet evolve after the child is born?
During the postpartum period and breastfeeding, mothers should be getting about an extra 500 calories per day. And so during pregnancy, we don't actually increase our caloric intake too much, but after the pregnancy we do. And again, those healthy fats are going to help because breast milk is a very fatty product, which is what helps grow humans and other mammals. But for our human babies, we definitely want all those good fats to come into our baby's diet. So again, those nut butters can be a great nutritious bite of food. When you are maybe not feeling as hungry, if you can just have a handful of almonds or a handful of macadamias or some good fatty nut, walnuts are a good one. Those will be really helpful to keep by your bedside when you're feeding your baby.
And are there any specific vitamins or nutrients that women should really be focusing on during that time, perhaps more than another? Like what are your critical ones?
I like a good multivitamin. I mean, the multivitamins have, your whole family of B vitamins. They've got magnesium and calcium. One thing about our soil and the environment right now is that a lot of our minerals are being depleted out of our soil in our farmlands. And so sometimes I do have clients add in magnesium into their diet. Usually that's something that I have them do before bedtime. So if somebody's getting a lot of muscle cramps or they're having some discomfort, then I'll have them add in magnesium and maybe more calcium into their nighttime routine. So for supplements, a good B multivitamin with the full family of B vitamins. Sometimes people need a little bit of extra iron into their diets. And then at night, some calcium and magnesium. And that can be for pregnancy and postpartum.
And a lot of viewers here, obviously, they want to get as much of their nutrition as possible through food. Is it possible to get everything you need without supplementation?
Yes. And again, because the soil has been, our farming practices are very aggressive in the United States. And so if you are able to buy plants from farms that are organic and being able to purchase those kind of leafy green vegetables will be very valuable in getting your magnesium from your foods. Leafy green vegetables such as collards, mustard greens, kale, those are very high in calcium and magnesium. And so I highly suggest people getting those when they can, getting them organic, because those practices are often more holistic or like a permaculture way because the soils haven't been depleted as much. But yes, they are very high in calcium and magnesium. And they're more readily available.
For sure. And we're just scratching the surface here, but you do work with clients one-on-one online. So if someone wants to look you up and work with you, what does that process look like? How can you help?
Sure. So I do individual health coaching. I also do group prenatal coaching. And our group prenatal coaching is really valuable because not only do clients get the one-on-one care with that midwife, but they also get all the community of having the other pregnant women in their same time period. And then we continue that through the postpartum. So questions that you might have that aren't being answered or somebody else has, like, it's just a really great community to have that group coaching for your prenatal and postpartum period. And so that's through experiencemidwifery.com. I also do individual health coaching through experiencemidwifery.com, and that's all online. So women from anywhere can join. It's great.
Cheryl Furer, thank you so very much for your time today. This has been really enlightening.
Thank you so much, Chuck. I appreciate it.
You are most welcome. Let's turn our attention now to childhood nutrition after the baby is born. Childhood obesity rates are on the rise. There's no doubt about it. We all want the child to grow up healthy and strong, but now there is evidence suggesting that heart disease and these chronic diet-related illnesses can begin in children kindergarten age or even younger. And it's something that they struggle with as they grow older. As a child, as a former child who was overweight himself, struggling so much to get that weight off once I become an adult. And all of the battles there, I can tell you firsthand how important of a topic this is. That's why I'm really excited that Dr. Vanita Rahman is here with us today to talk about childhood nutrition, how to get them excited about eating a healthy diet. And let's get a look at some of those trends here. Dr. Rahman, I know I've seen the charts that you're about to show, and really, how concerned are you as a physician at the rate of childhood obesity in this country?
Yeah, this is such an important topic, Chuck. We know that rates of obesity in adults are rising, where over 40% of American adults are obese. But what is so alarming is that rates of childhood obesity are also rising. They parallel adult obesity rates. And this is deeply concerning because children who gain weight early on are less likely to lose it as they go on to become adults, and they're more likely to develop chronic conditions. So we really need to put childhood nutrition on the radar because it's just as important for children as it is for adults.
Yeah, man, you talk about it being harder as you grow older. I mean, I had to go to extreme measures to lose weight. I got all the way up to 420 pounds, but I was in triple digits in elementary school. I will never forget being in the second or the third grade. We had a program where the police came in and they gave us, little identification cards, and they weighed us and they took our picture and they, put our height on there. So it looked like a little mini driver's license, but I had no idea that I was over 100 pounds already in the second or the third grade until I stepped on the scale, and I was actually mortified. I remember telling the person who took my weight, like, I need to go on a diet. But then, this is 30 some odd years ago at this point. But now, whereas not many other kids in my class were overweight at that point, you look today. Can you talk to us about those trends? Maybe I know that you have some slides that you can share here.
Yeah.
I think it's somewhere in the ballpark of 14 or 15% of children now are obese.
Yeah. So if we can get those slides pulled up, but yeah, the rates of childhood obesity are rising at alarming rates. So let's look at the next slide here and see. So let me break this down for our viewers. In the yellow, it's children overall, and then blue is for boys and pink is for girls. But if we just even focus on that yellow right there, you mentioned, Chuck, preschool age kids. So ages 2 through 5, almost 14% are obese. This is really alarming. And then if we look at school age children, ages 6 through 11, nearly 20% are obese. That's 1 in 5 almost. And then they continue that trend along teenage years where nearly 20.6% of teenagers are obese. So these are very troubling trends. And we see that the rates are more or less the same amongst boys and girls. So this problem with weight gain starts very early on, and then it just becomes an uphill battle along the way. And I can really feel for you as an elementary school child, feeling concerned about your weight because children just don't know what to do. They don't know enough to really help themselves at that point. And so let's look at some more trends here. And we see that since 1999, the rates of obesity have been steadily rising among adults from 30% to about 39.6. It's actually even gone past that. It's almost 42% now for adults. And then for children, again, we see this steady increase. And we really need to reverse this trend because children who start out obese are likely to become adults who are obese and then suffer with the same conditions. Let's see the next slide. And why is this important? Why it's not just a cosmetic issue. It's not just about fitting in, although all of that is important too for children, but it's also a health issue. We know that higher rates of obesity correlate with higher rates of blood pressure, diabetes, and then which in turn increase the risk for cardiovascular disease down the road. So if we look at the classification for blood pressure for our youth, ages 12 or greater, it's the same as it is for adults. So a normal blood pressure is now anything under 120/80. And when we're talking about blood pressure, there are two numbers. There's the top, which we call systolic, and the bottom, which we call diastolic. So ideally, we all want our blood pressure to be under 120/80. Now, anything between 120 to 129 over 80 is considered elevated. It's no longer considered normal. And if we look at the further classification, stage 1 blood pressure or hypertension is any top number between 130 and 139 and a bottom number of 89 or less. And then stage 2 is top number over 140 or greater and bottom number 90 or greater. Now, I'm just pointing this out so our listeners know what the classification are, because when we look at the next slide, we see what's been going on in children. Now, this is really concerning. 1 in 7 youths, teenagers, have elevated blood pressure or high blood pressure. That's 1 in 7, really alarming numbers. And a CDC study showed that 1 in 25 children have hypertension and 1 in 10 has elevated blood pressure. So if we're looking at a classroom of 25 kids, one of them will have hypertension, which is something that we used to rarely see in children. It was a disease of middle-aged adults, and now we're seeing it in our young kids. And let's look at what's been happening with diabetes on the next slide. And just to break this down for our viewers, there are 2 types of diabetes, type 1 and type 2. Type 1 is what we've traditionally thought of as an autoimmune diabetes, where there are autoantibodies that attack our own pancreatic cells, causing damage to the pancreas, which then no longer produce enough insulin. And it's usually diagnosed in childhood. It accounts for about 10% of diabetes in the US. 90% is type 2, which is related to lifestyle. And traditionally, this was something we saw in middle-aged or older adults, and now we're seeing it more and more in children. And what's really concerning is that the incidence of both types of diabetes is increasing. Type 2 is going up, and interestingly, so is type 1, as we see here. So really, lifestyle is playing a key role likely in both of these. And all of this is important because, we know that in the United States, the leading cause of death is cardiovascular disease, such as heart disease or stroke. In cardiovascular disease, we develop plaques in important arteries that supply blood to our brain or our heart. And these plaques can then rupture or cause a blockage, which can then lead to a stroke or heart attack. Now, this is a really the article is spot on when it calls itself this landmark article. This was published in 1953 in JAMA. And what it shows is that in a study that was done of American soldiers that were killed in the Korean War, the majority of them had already pre-existing heart disease. Let's look at the data. So these were young, presumably healthy men that died in trauma in the Korean War, 300 soldiers who died from trauma, and then autopsy studies were done in these. And let's see what the results show here. Their average age was 22, so fairly young. And surprisingly, when they did an autopsy, 77% of these young men already had plaques in the arteries that supply blood to the heart. So they already had evidence of coronary artery disease. And this study was published in 1953. And then the authors go on to conclude that other factors such as hormones and diet must be present before the disease progresses to plaque formation. So we have known this since 1953. And recently, another study was done in the United States on young people who died of trauma. This is another important study called a P-Day study. So let's look at the results from this. There were about 2,800 subjects, and their age and gender varied from 15 to 34. So really young people who died of trauma. And they were Black, white, men, and women. And they died of external causes such as trauma. So not necessarily cardiovascular disease or cancer. And they all had autopsies. So let's look at the results. And what's really shocking in this study is that 100% of them had early evidence of cardiovascular disease. There was already evidence of plaque formation in the thoracic and aorta, which are these large blood vessels that run down our back that supply blood to the rest of our body. And when the researchers looked at their coronary artery, which is again an artery that supplies blood to the heart, they saw that the majority of them already had evidence of cardiovascular disease in that coronary artery. And so let's remember these were young people ages 15 through 34. And this disease, cardiovascular disease, the leading cause of death in the United States and much of the world, was starting at a very young age. And one thing we do know is how important diet is in preventing obesity, in preventing type 2 diabetes, in preventing cardiovascular disease. And we know that a diet that's rich in fruits, vegetables, whole grains, and legumes is protective, whereas a diet rich in added sugar, high in sodium, high in processed meat is harmful. And let's look at how our youth are doing. And this was a study published in JAMA a few years ago. And what's so concerning in this is that the average youth is not even getting a single serving of fresh fruits a day, even though they are abundant in the US. However, they are getting one serving of sugar-sweetened beverages a day. So we really need to change that. And the average child is not even getting a single serving of vegetables. And those dark green vegetables we talk about, like bok choy and spinach and kale, 0.06 servings a day. So really a dismal amount. And the average youth is getting just about one serving of whole grains a day, but over 6 servings of refined grains. And we really need to flip that. We should encourage our young people to be eating whole grains, which are protective as opposed to refined grains. And as we see here, the amount of added sugar, 71 grams of added sugar a day, that is almost 18 teaspoons of added sugar a day. And the average child is getting 50% more sodium than they should because they're eating generally a high processed diet and getting very little soy, which we know is so beneficial in our health. So what this study really shows us is that, we have so much we can improve on our children's nutrition, and we really need to focus on that.
Well, let's round out this conversation by asking, children and their parents, for that matter, are bombarded with marketing for these unhealthy foods. It's no surprise that how many sugar-sweetened beverages kids are drinking. It's no surprise when you look at the amount of refined grains a child is eating compared to whole grains. No surprise there when you turn on the TV, you go on YouTube, you look on their cell phones, whatever the case may be, wherever they go, they're seeing advertisements for junk food. So how do you then combat those marketing ploys and get them excited about the idea of eating fresh fruits, eating fresh vegetables? What is the trick there?
Well, it depends on the child's age. Most children I sometimes find it's easier to help children change their diet than adults because they're not as set in their ways yet. So giving them age appropriate information about what is healthy, what is not, explaining that we're going to eat fruits and not drink fruit juice or soda, and explaining why, and just at a very age appropriate level. But very importantly, leading by example. So if kids see their parents reaching for soda or processed meat, then they're going to feel that's okay and they'll do it too. So really bringing nutritious foods in, offering them nutritious foods, and being patient, knowing that kids may not love that, broccoli today, but maybe by the 10th time, it'll be their new favorite.
It's an acquired taste. Broccoli is an acquired taste. I know, when I started out on a healthier path, my taste buds changed dramatically. And I do wish that I was introduced to healthier foods growing up, and maybe I wouldn't have wound up in the pickle that I was. But I'll tell you another thing before we open up the doctor's mailbag is that you were talking about the prevalence of hypertension among children. And I remember being put on high blood pressure medication when I was a freshman in high school. So I was right at that 13 or 14-year-old range, and my blood pressure was untreated, routinely 170, 180 over 90 or 100. I mean, it was up there. I mean, that's pretty scary. I mean, what are the cardiac risks for a kid that young?
The risks are going to be very similar to what we see for adults. So increased progression of cardiovascular disease, those plaques that develop. And we know that high blood pressure also causes progressive kidney damage. High blood pressure and diabetes are the leading causes of kidney failure in the United States. And we know it can impact our retina. So really the consequences are quite dire, and it's really important to be on the lookout. And I can imagine how hard it must have been for you, Chuck, as a high school freshman, to be dealing with this.
Oh, it's heartbreaking. I mean, I was like, this is my dad's problem. This is my grandfather's problem. This isn't my problem. I'm
Right.
13 years old. What are you,
Right.
crazy, doc? But no, I mean, daggone. And then you go and you look at what foods I was eating. I mean, I was probably eating way less than one serving a day of fresh fruits and vegetables. I mean, it was probably closer to one a week, which is just flat out sad. But let's go ahead right now, Dr. Rahman, move on and open up the doctor's mailbag. We have a great question today. That's a fancy graphic. We have a great question today from Juliet. She's wondering about B12 in children. We know that adults have to supplement with it, but how much B12 does a child need? And she also writes that she heard that if you're deficient in B12, you may be more likely to be overweight. So what do you know about that?
Yeah, so a couple of things. So B12 requirements vary with age, less for infants, more for children, and then more for adults or lactating or pregnant women. But overall, the requirements are still very small. We're talking about less than 3 micrograms of B12 a day, which is just a minuscule amount, but it's so important that we get it. The most important thing to do with children is to make sure, if they're following a plant-based diet, is that they are taking that supplement. And young kids do not like to swallow pills. If your child does and they do it safely, great. If not, you can get them a sublingual, which is a pill they put under their tongue and it just dissolves. You can get them a spray, which you just spray in the back of their throat. There are many different formulations out there, but whatever you get, you will likely get plenty of it because we need so little. Now, as far as B12 deficiency causing weight gain, I'm not aware of research showing that, but we do know that B12 deficiency can be quite severe. It can lead to progressive neurological damage, cognitive dysfunction. So it's very important to get that supplement and know that at least for adults, we can monitor B12 levels. We can do that for kids too, but kids don't like to have their blood drawn.
Yeah, well, I'll tell you, it's not just kids that don't necessarily like pills. My wife, she takes the sublingual, cherry flavored. She just can't stand the little tablets. So that is good advice for all ages. Dr. Vanita Rahman, thank you so very much for your time today.
Thanks, Chuck.
All right. And you can schedule an appointment to meet with Dr. Rahman at the Barnard Medical Center. Right now, telemedicine visits are available. All you need to do is log on to barnardmedical.org or call 202-527-7500. Find out what states have services available. And yes, in those states, insurance is accepted. So go ahead, make an appointment with Dr. Rahman or any one of our other plant-based doctors or dietitians, 202-527-7500 or barnardmedical.org. And real quick, before we get out of here, let's get a look at at what's happening, your health headlines for Thursday, December 3rd, 2020. And we begin with a look at the coronavirus, where records are continuing now to fall. And that paints a bleak picture of what is to come before vaccines are available to a wide swath of the population. Wednesday, 200,000 new cases being reported as a record number of COVID-19 patients now are in the hospital. Doctors are currently treating more than 100,000 patients around the clock. 20% of them are in intensive care. Yesterday, a record number of patients unfortunately also losing their lives, more than 2,800 people dying just before the holidays. In more positive news, this is huge. Big-time meat companies appear more ready than ever to ride into a meatless future. For the first time, plant-based alternatives will be featured at the meat industry's largest trade expo beginning in 2022. The change is being made in response to undeniable growing consumer appetites for meatless options. Annual sales for plant-based meats are expected to rise by 18% each year, compared to just 0.2% for traditional meat. And finally, tennis superstar Venus Williams is serving her way into the vegan game. The 7-time Grand Slam champion is launching Happy Viking, a line of vegan protein shakes. Williams adopted a plant-based diet after being diagnosed with the autoimmune disorder Sjogren's syndrome in 2011. She credits the change for not just restarting her career, but returning her to championship form. Within 10 months of going vegan, she won her 5th Wimbledon title and an Olympic gold medal. That's awesome. All right. That is all the time that we have for the show today. On the program tomorrow, we have Dr. Jim Loomis here. For the full half hour, he will be answering your questions. So if you got something you want the doctor to answer, go ahead, post that in the comments section now. We'll get to as many as we possibly can before the show is over tomorrow. But for today, the show is in fact over. I want to say thank you one more time to Cheryl Furer for joining us, as well as Dr. Vanita Rahman and the crew behind the scenes that makes the magic happen. For everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thanks so much for tuning in, exam roomies. We'll talk to you again tomorrow. And until then, stay safe, take a stand, and keep it plant-based.